Joining me on the broadcast now, Professor Manindra Agarwal, part of the government supermodel committee, also a professor at IIT Kanpur. I want to show you the state trajectory data of COVID cases. Now, this blue line is Maharashtra, which shows that at 62,194, the total number of cases is coming down in Maharashtra. Cases are also seeming to come down in Uttar Pradesh, but going up quite substantially in Karnataka and Tamil Nadu as also Andhra Pradesh. So the COVID wave shifting now and reaching the shores of the south. Professor Agarwal, welcome. Can you give our viewers the latest on what your models are suggesting about the current state of the COVID reproduction rate in our country? We picked up that data from the University of Michigan, which says that the COVID R factor is coming down to about 1.14, 1.18, which essentially means that it's much lesser than the 2+ which India was seeing. Does that suggest that maybe in a few days from now we'll actually see cases starting to come down?
Yeah, thank you for having me on the show. Just want to clarify one thing first. The National Supermodel Committee that was formed last year, and I was a member of that, as you said. Now, the committee was given a charter, which it finished and submitted its report. Now, since then, 3 of the members of the committee, we have been working on this model called Sutra and have continued to come out with projections for the future. So what I'm going to share is what has come out of this model and its predictions. Yes, according to our model as well, the cases seem to be nearing its peak in India. Our estimate of reproduction number is actually less than 1.1 right now. So roughly agreeing with what you mentioned. And what we believe is that very soon we will turn the corner in terms of new cases. The new cases should start dropping. It will still take some time, maybe a week or 10 days after that, for active cases to start dropping. And it's the active cases that really determine the load on hospitals. And so hopefully by around middle of May or a little later, we will see a reduction in the load on hospitals.
How are your estimates in March? Because one of the biggest complaints against the government has been that those modelers who've been providing data and estimates to the government simply failed to read the magnitude of the wave. So what you're saying about the future, I take more seriously if I knew that you predicted the past well.
Absolutely. You are under no obligation to take what we predict seriously at all, nor do the viewers of the show. This predicting future is a very uncertain science. Just like weather, one sometimes get it right, sometimes one doesn't get it right. But we all try to learn and improve. We are very right that none of us were able to predict the intensity of the second wave. In our model, we did roughly predict within, let's say, plus minus 10, 15 days, the peak time of the wave. But we couldn't get the intensity.
Why not?
Right.
When you look back and you're a modeler, so you're studying the limitations of your model, what is it about this wave that you and everybody else missed, which is why the people of India were caught so off guard? Nobody in February, March told us that April and May are going to be so bad and that we needed to prepare. It's almost as if we walked into a death trap.
2 reasons. First is the mutant. You just cannot predict how virulent a mutant could be. Our estimates were based on what virus was existing at the time, the virulence of that virus. That's one thing that took everyone by surprise, not just us, everyone by surprise. The second, and also that's actually, I would say it's even more important, is the estimate of currently what fraction of population is immune. Because the lower the immune population is, the more people are available for the virus to infect. On the other hand, if a higher fraction of population is immune, virus doesn't get that much of a leeway and therefore cannot spread that much. Now, in fact, none of us had any estimate of the current state of immunity in the population. There were some surveys done by ICMR. The latest one that was reported was in early December and early Jan. But by March, perhaps many of those people may have lost immunity, because after all, the immunity only survives for a certain period. And to estimate that really was very practically impossible, because one doesn't have reinfection data as yet. And in fact, going forward, what it will be my recommendation is that we should, as a nation, conduct regular serosurveys, fast, quick serosurveys, so that we can keep track of where the population is losing immunity and take corrective steps.
I'll leave it over there for the time being. I realize that you were doing a tough job. This is not your original vocation. You're trying to step into a very, very fluid, very volatile and uncertain situation. And hopefully your predictions about this wave having peaked and caseload starting to come down will come true, because we really need this nightmare to end. Professor Manindra Agarwal, for joining me on the Newstrack. Thank you, sir.
Thank you.
We'll slip into a quick break. I'll have more for you when we come back on the other side. Stay with us. We're back in a